You wanted to bring up United Health?
Yeah. So it's just I think just in the time that we decided to shoot this podcast, in terms of real world events, a few weeks ago, former CEO of United Healthcare, Brian Thompson, was killed on the street by a person who was disgruntled. The story, this individual wrote kind of what the media is calling a manifesto, like he's like some, supervillain from like a Batman comic.
He's been compared to the Unabomber, I believe.
Yeah, well, the Unabomber didn't care about innocent people. And not condoning murder, first and foremost. Murder is never the answer, and never really in my opinion, the choice to make. But this individual, Luigi, wrote about how his mother suffered from crippling chronic pain. I don't know if she had like spinal stenosis or what it might be, but her whole, since she was in her 30s, she would have to crawl on her hands and knees to use the bathroom, multiple surgeries, and dealt with insurance companies, instead of being a group that helped facilitate wellness, being a roadblock, not approving care, and then this individual, it seems, I'm not clear on 100% of the details, but it seems that he has something similar to what his mom had, where he had to get neck surgery, and he also suffers from chronic pain, and he's being, has claims denied to receive care. And this kind of brings up a kind of like this thought that, like, why are we letting banks decide what sort of care should be rendered for people? And I find this personally frustrating working in
insurance
healthcare.
Companies?
Yeah, which are banks. That's what they are. Why are they deciding? Like they're calling Brian Thompson a CEO of a healthcare organization. It's a bank. And, it's about profiteering off of collecting insurance deductibles, and approving less and less.
Yeah, this is one of those examples where we tell our pre-med students that they're entering a very bureaucratic industry.
And as time goes on, I don't mean to sound like RFK here, but like as time goes on, it is kind of alarming how we see this corporatizing, this corporizing, all these hospitals going corporate. And we see that all the funding for all research is kind of backed up by these big businesses. And like we are working in a industry that is profiteering off of illness. And, is it time for private insurance to go away?
And aren't a lot of hospitals nonprofits?
Yes, hospitals themselves, I think, are nonprofits, but I think the hospital groups, but
yeah.
You also, the reason they don't have an endowment, they pay out bonuses. So there goes their profit. But it scares me because, like, Ruthie, you bring up a point, and it's something that, like, I notice where because there is a lack of coverage, a lack of knowledge, people are using us as their PCPs. I have people who call 911 and they're like, my blood pressure's high. I'm like, okay, I'll take you to the emergency department. They're going to discharge you and you're going to get a bill. And it's it's this cycle where I really see that our healthcare system, if it hasn't collapsed already, it's on the verge of it. You know, waiting times in the ER, people who can't pay their medical bills. You know, I think it is kind of like one of these situations where we really, as you know,
it's a negative cycle, and I think you have to choose your battles of what you want to tackle. Do you want to tackle legislation? Do you want to tackle it through public health? Do you want to, you know, and I think EMS has a very unique position to do a little of everything.
Yeah.
But it's picking your battles.
Yeah,
right?
I think so. You know, one thing that you know, this isn't a political podcast, but one thing that like just bothers me so much is that supporting private health insurance like Blue Cross Blue Shield, United Healthcare, Aetna, being in support of these companies is the patriotic thing to do. That you are some, you know, left-wing communist crazy person for entertaining the idea of, you know, socialized healthcare or universal healthcare, and that just bugs me so much.
So what category do you fall in if you don't subscribe to healthcare? Because that was me for the longest time.
A moron.
A moron.
Just kidding.
I told Marty this before we started recording, but I got very lucky. My week-long hospital bill came out to $5,000.
You're kidding.
Because the hospital subsidized 80% for uninsured individuals.
Even then, that's. I mean, that's a great scenario, right?
Yeah, very lucky.
But you look at these people like, and I guess maybe I'm becoming radicalized because my mom has spinal stenosis, and insurance provider, United Healthcare. She has documented spinal stenosis. She gets a cortisone shot. She can get one every 3 months or 4 months. And she's up for a shot. And they're like, United Healthcare says, you need to get another MRI. She's like, I got an MRI 4 months ago. Right. Like, you need to get another one. Okay, gets another MRI. Has to pay the deductible of that MRI. And then they say, okay, you need to fax over the MRI. It was sent digitally. We need it faxed too. Then we need a mail copy of the MRI. And then, you know, oh, sorry, you know, your request for the shot has lapsed, so you need to request it again.
Good Lord.
And it's this stupid game, and it's not. I mean, you read stories, and again, this is on social media, but you read stories of like these doctors who are trying to prescribe Zofran to a kid with cancer, and United Healthcare denying that. I mean, like.
Yeah, I saw that letter.
Yeah, and again, it's like I'm not condoning murder. Murder is wrong. But when you have all the ingredients to bake a cake mixed together, you're going to get a cake. And I think, you know, you see these people with like chronic pain and, you know, to live every day of their life in pain and not having a solution, and just being in, like, you see people with cancer, end of life, you know, childhood cancer, where the insurance company is something we have to worry about.
Right.
Our parents didn't have to worry about that. This is a new, well, it started in the 70s, but like, this is not, it needs to change, because I really do think that once you have insurance companies covering less and less and less, kind of a point you asked earlier, is it even worth it to have insurance anymore? People don't have insurance. When they have a problem, they're going to call 911. They're going to go to the ER, and that's how they're going to receive their care. Now, this 20-hour wait time for the ER is going to be a normal thing. Mm-hmm. I think it's...
So what's the happy middle? Or is the solution socialized healthcare?
Well, if you look into statistics, you look in the data, I mean, we're the only nation that has this private healthcare system, and we're by far not the most healthy country. So I don't know what the middle ground is. Well, the middle ground is insurance companies start paying for, things that people need.
Yeah.
And doctors make decisions. One thing I was thinking about, I'm like, what if like instead of private health insurance, you subscribe, and this is kind of like an HMO, but you subscribe directly to a hospital. Like I'm going to sign up for Loyola Hospital, and that's where I receive all my care, and I pay them $100 a month. I go into Loyola, I get whatever I need. And it would have to be subsidized by the government. But, I think that it's the direction it's heading. Ruthie, I would like you to comment on this if you could. The direction that healthcare is heading doesn't seem like a good one. I mean, I have a chronic medical condition. I used to see an endocrinologist every 3 months. Now I can barely see them once a year. Maybe it's
due to
once
cost?
No, due to no availability.
Availability.
Oh, wow.
Yeah.
And it's like, it's just really tough.
Yeah.
Yeah.
It's such a broken
Is that
system.
a concern that a lot of your patients express?
Absolutely.
I have people say, I cannot go to the hospital. I cannot afford it. And what do I say to them? Sir, you're having a heart attack. Don't worry about not paying for it. I mean,
Sign here, refuse here.
the amount of people who have done their diligence to try to follow up with a PCP, but the next appointment they can get with a specialist is 9 months from now.
yeah, a pain doc.
Yeah,
Yeah.
or a neurologist for their migraines or whatever it may be. So they end up right back in the ER, and then they're going to get stat ordered tests, which is great. It'll provide them maybe some answers and some help immediately, but then they're faced with this bill, and I think if there was a way to take out the greediness of the healthcare industry or the insurance industry, and make things cost what they actually
What if insurance
cost.
companies were nonprofits? with that,
Well, they call themselves nonprofits probably,
Right.
but it's
Things. The charges and the hospital bills, and it doesn't represent what things should actually cost.
No.
and they're
it's
set by the insurance company.
yes, it doesn't make any sense.
the
$200 for Tylenol.
the hospital subsidizing 80% is just a sign of that too.
yeah.
Well, you could go to I'm type 1 diabetic. I could go to Mexico without insurance and buy a vial of insulin for $16. In this country, with insurance, I'm paying $30 a vial.
Yeah.
I mean, and again, like they used to spoon feed us this bullshit that like, you want universal health care? You're going to wait 10 hours for that broken foot. Go in the waiting room of any hospital in this country and tell me you're not waiting more than 10 hours. And on a bad day, even longer than that. So like, I understand the not wanting to trust bureaucracy in the government into kind of handling compensation for medical issues. But at the same time, we have 3 insurance companies. What's the difference? At least the government's goal isn't to profit, where the goal of these insurance companies is to profit. It's not to help people. It's to profit off people. And it's, you, after becoming a parent, and like people say this all the time, like, I worry about my kids. And, I think it's bad now, but like how bad is it going to be, 30 years from now? Or 20 years from now. And that's where like for the first time it's just like, man, for like things like if we can't get good health care here, if we like are, again, not to sound like RFK, but if we're feeding our kids like poisonous food, when is it maybe living here is not the best thing anymore? And I think that like working in healthcare, that sometimes I kind of have that perspective of like holy shit, what is going on out here? I don't know. Guess we just hope and pray.
Yeah. It's It's like what's within your control.
Yeah, and I think that helps you go to sleep at night, right? Yeah, you know, I don't want to be some bleeding heart that fixes the world. But when you talk about what's in your control, but also, you know, you can't think of the I can't be indifferent to the amount of selfishness that it just exists of people who's, you know, who are using their talents and their intelligence to rip people off rather than help people.
Curious how they feel about it, you know, the execs of these insurance companies.
Yeah. Well, regardless, folks, of what you think about it, you're not the good guy.